Thanks for joining us. While we give folks a couple minutes to trickle in, we have a couple of poll questions that we prepared for you. So we're gonna launch that poll that you can answer while you wait. It should show up in the chat. The question is, what type of climate-related issue has most impacted you or your family? If you're not seeing the poll in the chat, no worries. I'll summarize the results. But if you want to start answering that while we wait, we're just going to give folks another couple minutes to trickle in. All right, are we ready, team? I'm here with some of the climate team. I'm Brad Kramer. I'm the manager of the Climate and Health Equity Initiative. I'm joined with, maybe you can.
Hi all, I'm Addison Houston. I'm the climate adaptation strategist.
Hi, I'm Sonia Jampel, she, her. I'm the Applied Epidemiology Fellow.
Hi folks, I'm Jennifer Deb. I'm the Communications Specialist for the Climate and Health Equity Initiative. Thanks so much for joining us today.
Great. Thanks again for joining us, and thanks for answering the poll. So it seems that, no surprise, wildfire smoke and extreme heat are the most common because those are the most common events that we've been experiencing in recent years here. Thanks for answering the poll. I'm going to move along. I don't know if the poll just closes, but all right, it closed. So thanks for joining us today. I'm the manager of the Climate and Health Equity Initiative. Our part of this is to introduce ourselves and to let you know that that we're here and to support climate work in public health. And so we're going to give you a 30-minute presentation followed by question and answer. You don't have to necessarily hold your questions till the end. You can put them in the chat. We probably will wait till the end to address them and facilitate some conversation at the end. By the end of the day today, we're hoping that you will get a better understanding of how climate impacts health, who's most affected by climate change, and how climate change relates to health equity. We'll give you some examples about what climate action is happening here in King County across our agencies, but also in public health. Give you some ideas of what we can do as public health employees to help our community. And then we want you to leave knowing who and what the Climate and Health Equity Initiative is and does, and how we might help you in your work. And so it's Earth Day today. Happy Earth Day, everyone. It's a good time to reflect on the impact that we're having on our climate. I want to emphasize that this is not something we can afford to think about just once a year. We think it's important to think about climate change every day. And so people are motivated to protect their health and the health of their families. So as public health employees in particular, we have a real opportunity to help motivate people into action around climate change. Many of us have heard about the toll of climate change and how it's impacting our youth and mental health, and taking action to address the impacts of climate change can help reduce this climate despair and climate anxiety. Action is a remedy to this. So the fact is, climate change is happening now. Communities can learn to adapt and thrive in the face of this climate change. And this is the example that we like to start out with. Of action in the background. There's the spray park at Seattle Center. Many of you have probably been there, and so we like to lead with this example about how we can change infrastructure and knowledge to stay safe and keep cool during extreme heat events, and we can help our community have the knowledge and resources and the need that they need to protect themselves from climate change. Next slide. So. What's climate change and how does it impact health? The World Health Organization has called climate change the single biggest health threat facing humanity. And but a lot of that topic has been more on the environmental side. And I also know that a lot of us are coming with various levels of knowledge on this topic. So today we're just trying to start from scratch, or start to scratch the surface on these topics, and then shift the focus to the health impacts and what public health is doing. We know that the use of fossil fuels, coal, oil, natural gas is leading to our planet warming. That's why, as a society, we need to move away from them and do things like switching to greener energy sources and using more sustainable practices in our transportation and agriculture. The biggest sources of emission are also the biggest sources of ground level ozone or smog, which can contribute to health consequences. And there's an urgency and an importance to mitigate these greenhouse gases. But also health programming often lives in what we call adaptation. Now that climate change is here, how do we adapt and maintain healthy communities? Next slide. You've all seen the headlines. They're a bit overwhelming. And these are global headlines just pulled from 1 week of news. They can bombard us and they can often lead to a bewilderment of what we can do. These are global headlines, and in the next slide, there's also national headlines, and there's this video embedded in the slides that you can view on our SharePoint later when that is up and running. But I want to blast past this a little bit and move on to away from some of the gloom and doom pieces that can overwhelm us during the day. I want to start shifting towards action, but I can't fully get there without introducing some of the gloomy topics of how climate impacts health. So what you're seeing on the screen is a graphic from the Centers for Disease Control. In the center circle, you have the effects of climate change, and you have the CO2 rising, you have rising temperatures, you have more extreme weather, rising sea levels, and then outer to that, you have the exposures or the environmental changes that you will see. Increased air pollution, increased ticks and mosquitoes, increased allergens, and around the circle. And then the final outer circle shows the health impacts of these associated increases in exposure. I used to work for a asthma program here at Public Health, and so if you look at the top of the circle, you'll see air pollution impacting respiratory disease, asthma, and cardiovascular disease. And as you continue along, it also is increasing allergens, which can exacerbate and lead to an asthma attack. And those increasing allergens are part of shifting pollen seasons, which can really impact our food supply and how our agriculture is raised and harvested. And then there's extreme weather that can increase, extreme precipitation can increase mold, and which leads to asthma consequences. You can begin to sort of paint that picture across other diseases and other exposures. Next slide. But who is harmed by climate change is not equal. We have another poll here, so let me launch that. How would you describe your understanding of the links between climate change and health equity? Sort of read the room of where you're at in this coming to understand climate change and health. You can launch the poll from the chat. If the poll is not working for you, don't worry, I'll summarize the results. I'll just give it a couple seconds. Wow, we're quickly at 25 responses. Folks are sort of in the middle. You know a little, but still have a lot to learn. That's a good place to be. That's why we're here today. Great. So great to see all the responses. Again, thanks for joining us. I'm going to close the poll, but it sounds like we're all sort of in the middle of this journey together. And so we're here to help with that. And hopefully this talk helps, but we'll have ways to engage with us afterwards. But the key message here is climate change affects everyone, but does not impact everyone equally. It disproportionately harms marginalized communities, including communities of color, low-income households, and people experiencing homelessness. Other groups that are more sensitive include outdoor and agricultural workers, young folks and older folks, pregnant people, immigrant communities, people with limited English proficiency, people with pre-existing health conditions, including mental health. Each climate exposure impacts communities differently. Those most impacted by heat may not be those most impacted by flooding, and those most impacted communities experience harms at lower levels of exposure. So it's important to center on these communities and center on those most impacted by climate change. Next slide. And so that's some of our next steps, understanding who is most impacted and why. Understanding why understanding why they are most impacted can help us shift towards prevention or reduce the health reduce the health impacts they're experiencing. This slide is a diagram that walks through what an epidemiologist calls a vulnerability assessment. Defined here, vulnerability depends on a combination of these three factors: exposure, or the contact the person has with the climate harm. You can think about outdoor workers spend hours outside and are exposed to wildfire smoke and extreme heat differently. Sensitivity is how much people are affected by their exposure to climate change. So people with a pre-existing condition like asthma is very sensitive to wildfire smoke, which can exacerbate their symptoms and lead to an asthma attack. And then there's the ability to adapt, to prepare for these potential hazards and reduce their exposure or the harm, or quickly recover from them. So households, low-income households might not have as much ability to adapt in extreme heat, such as access to air conditioning, green space, spray parks for cooling, and then transportation to cooling centers or even places like a movie theater to get out of the heat. This graphic helps us understand how climate change does not impact all of our communities equally. And then it can help us lead to a better assessment of their vulnerability to heat or wildfire smoke. Next slide. And then this graphic sort of walks us through some additional context, because before acting on these data about who is most impacted and building health programs and policies to address this, we also need to understand the historic, social, and racial histories and context. Let me walk you through an example here on the slide of extreme heat and how location economics and social and racial factors influence who is most at risk during extreme heat. So starting in the upper left and then moving clockwise, we can consider how systemic racism over the course of generations has shaped our society. So certain communities have been put and continue to be put in harm's way. So, for example, redlining caused Black, Indigenous, and other people of color in our area to be forced to live into less desirable neighborhoods. These are areas that are close to concrete and industrial zones with more air pollution, less green space, and few affordable cooling options. And we can see the heat is more intense in these neighborhoods, and then also is retained into the evening and doesn't dissipate. And social racial factors and environmental racism and social determinants of health can also lead to folks being more likely to have certain pre-existing conditions that place them at greater risk in the heat, like high blood pressure, heart disease, and diabetes. In the bottom right-hand corner, you can consider how compounded risks, such as communities facing multiple stressors at the same time. Maybe during a heat event, there's also a drought event or wildfires, smoke event, or COVID. And then also, even with cooling options, such as a heat pump or air conditioner, being able to run these, or the sort of energy injustice may also put you in face of greater risk. The key message here is public health employees, we have the responsibility to look out for the health of our most impacted communities. We need to start taking action now to educate ourselves, educate our communities on how they can protect their health, and ensure we are all able to adapt to the changing climate, regardless of our demographic or socioeconomic factors. Next slide. So this is what leads us to this initiative, the Climate and Health Equity Initiative. And it was a long runway, that's a bad example, long runway to an electric plane that took about 10 years for this journey. Early on, we started out with a climate action team. This was a cross-divisional team of folks that got together around the table to think about how we can begin to do this work. It led to us publishing the blueprint, which is a document you can explore that explains how the public health department here in King County can address climate and health. And many of these actions were brought into the 2020-2025 Strategic Climate Action Plan, or SCAP, that you'll hear more about. And so we've now been called upon to do about 70 actions in the SCAP, leading in some, supporting in most. And they're rewriting the SCAP in 2025, so there's even more opportunity for us to get involved. All along the way, though, you see at the bottom is the climate events that were happening. The wildfire seasons, we were reacting to those. They were new to us, and they were sort of episodic, happening infrequently. But now it's become a consistent season, a wildfire season. And we have the extreme heat events, especially with that 2021 heat dome that you likely remember, and then a recent flooding event. That is all compounding into a call to action for public health to show up. I'm going to pass it over to Addison to take us through the next set of slides. Thank you all.
Thank you, Brad. So as you can see, climate work is happening all across King County. So let's turn to some examples for other agencies, and then we'll explore what we're doing here at Public Health. Our climate work is primarily driven by two strategic documents here in King County. As Brad mentioned, there's the Strategic Climate Action Plan, which includes actions from all King County agencies and departments, as well as we have here in Public Health our blueprint for addressing climate change in public health. We'll share links to these documents in the chat, so you can check them out later if you'd like. The Strategic Climate Action Plan includes hundreds of actions taking place in all areas of the county's operations, as well as in partnership with King County municipalities and cities, partners, communities, as well as residents. It organizes efforts underway in the county through three broad areas of work: reducing greenhouse gas emissions, the source of the problem, planning and preparing for climate change, and sustainable and resilient frontline communities. This part includes community collaboration, education, and capacity building, while providing resources and building community capacity to adapt to climate impacts. Next slide. Here are some examples of a variety of climate initiatives happening across the county. At King County Metro, they're working to transition their entire fleet to zero-emission vehicles. They currently have about 1,400 buses, of which 51 are now battery electric, as well as 175 electric trolleys. In 2026, they plan to add a new interim base with charging infrastructure for 120 battery electric buses. Next year, they're beginning construction on the south base, which will have capacity to charge up to 250 buses. They're not the only agency with electric vehicles either, though. We have electric EVs in our fleet across King County agencies. This next image is work being done by the King County Wastewater Treatment Division. This is the Georgetown Wet Weather Treatment Station, which came online in November 2022. It's an example of how King County is adapting its infrastructure to account for climate impacts. This facility can treat up to 70 million gallons of combined rainwater and sewage per day that would otherwise be discharged directly into the Duwamish River during a heavy storm. Before the station was completed, heavy rains would fill up the area's sewer pipes, sending polluted runoff and sewage through pipes into the river. This station is designed to withstand 2 feet of sea level rise and can treat high flows coming from severe rainfalls, which are occurring more frequently due to climate change. The third image is one of the efforts under the focus area of the Sustainable and Resilient Frontline Community section of the Strategic Climate Action Plan, which focuses on food systems and food security. This includes expanding support mechanisms for low-income and frontline community members who could be disproportionately impacted by climate-influenced food insecurity. King County has a local food initiative, which is an umbrella for many different programs. Is a farmland leasing program, which makes land available to historically underserved growers and increases the amount of healthy and culturally relevant food produced locally here in King County. In this picture, a refugee from Burundi is farming her small plot on Horseneck Farms in Kent, Washington. This farm used to be a single corporate farm, and the county is gradually transferring portions of that to small-scale farmers. Almost all of the farmers are immigrants who farm in their own home country, and now they're bringing those practices here locally to King County, where they can grow a diverse selection of culturally relevant foods to help feed their families and sell at all farmers markets across King County. As you can see, climate work is happening all across the county in a variety of different ways. Now let's explore here a bit more what is going on at Public Health. Next slide. Before we dive in too far, we'll launch a third poll question. So the poll should now be available in the chat. We'll give you a few moments to answer the question here. The question for those that might not see it is, prior to this presentation, had you heard of our Climate and Health Equity Initiative? As responses come in, it's great to see that several of you are somewhat familiar with our work. But for those of you not familiar with our work, Public Health's Climate Health Equity Initiative is a cross-department interdisciplinary team that brings together staff from many of our divisions, reflecting the reality that climate work touches all areas of our work here at Public Health. Our Climate and Health Equity Initiative was formally launched in 2022 with the goal of building capacity to prepare for, minimize, and respond to the health impacts of climate change here in King County. Our team stewards several public health projects that are called out in the King County Strategic Climate Action Plan, with 3 broad focus areas that include data monitoring, communications and community partnerships, and response and adaptation to climate impacts and hazards. In addition to leading the department's efforts under these 3 focus areas, we also coordinate and collaborate with other King County agencies, jurisdictions, and regional partners, and serve as an internal resource for other public health programs when it comes to integrating efforts to address climate change into our work. That means if you're interested in doing this work, getting engaged in climate change and taking climate action, we're here as a resource to support you. Some of you may already be doing climate work. If so, we'd love to hear more on what you're doing. Others may not know how to get started, but we're offering also a second part to this training upon request in the form of a workshop with individual teams. We can come present to you more in depth on the work we are doing, and we can help you brainstorm ways to incorporate climate change into your existing work, where we can offer examples, inspiration, and resources to help support your teams along their journey. I'll go through some examples of the work our Climate and Health Equity Initiative are currently doing in each of these focus areas. Feel free to think about any of the other things that might be of relevant to your personal areas of work. And if you'd like to hear more, or if we can serve as a resource or jumping off point for you to think about how to integrate climate into your work, please reach out to our team. So our Climate Health Equity Initiative, one of our core areas is data monitoring. In our data monitoring function, we are focused on who is being harmed most by the effects of climate change and what conditions are contributing to those disparate harms experienced by climate change impacts. Whether that's physical, mental, or environmental factors that are contributing to some of the inequities we see come to play when we talk about climate impacts on our communities. We recently launched a new data dashboard that will be dropped here in the chat, which explores how climate is impacting the health of King County residents through a variety of indicators. The image here in this slide shows a display of how ED visits or emergency department visits for heat-related illness vary based upon demographics. We know that some groups of people in some communities are more vulnerable and more affected than others. These charts can't tell us the full story, but they are a starting point to show impacts to the community, and this can help guide future decision-making, especially for long-term risk reduction and adaptation efforts, as well as policy and response efforts. Our climate communications work focuses on drawing connections between climate change and health by broadly educating community on how climate is impacting our health in ways that people might not be thinking of. Our goal is to provide actionable information to help communities reduce their exposure to climate hazards. We aim to engage with communities in relevant and accessible ways so that messages reach those most at risk. To do that, we employ a lot of visual communications, translate our materials into multiple languages, and work with local community media partners. For example, our Stay Safe in the Heat comic includes culturally relevant practices and has been translated into 11 languages that will be used for the third year straight as part of an educational campaign in the community through and by engaging with multilingual media outlets. Our final area of focus is adapting and responding to climate impacts. For our focus on response and adaptation, our goal is to move from being responsive to climate impacts to being more proactive in long-term risk reduction to reduce the potential harm to the public that can result when these events occur. This includes developing public health recommendations and action thresholds for climate-related hazards. Adaptation measures like direct resource distribution to help address existing disparities are also another example of how our work is currently supporting our communities. For example, over the past 3 years, King County has engaged in the distribution of box fan filter kits to low-income residents across King County as a low-cost way to create clean air indoors during wildfire smoke events. Since 2020, we've partnered with over 30 different community-based and faith-based organizations to distribute over 3,500 of these box fan filter kits to priority populations. Now we're moving more towards educating about indoor air quality and have created some educational resources to continue supporting communities. There are a few projects that Climate and Health Equity Initiative and Public Health are still involved in. As you can see, climate work can take many forms. What might it look like to your team? It's important for King County staff to be knowledgeable about climate change and its impacts. We have many resources for you on our internal SharePoint hub that we'll be launching here in the next couple of weeks. We'll send out a list of this or a link to this resource as well as other links to this presentation after. We encourage you to check out the Strategic Climate Action Plan as well as the Blueprint for Addressing Climate Change in Public Health to learn more about what public health and King County are doing to stay abreast of the new developments. Again, we also encourage individual teams to reach out to us to schedule workshops where we can come and discuss ways for you to incorporate climate change into your existing work. If you're already doing climate work, please do get in touch with us and let us know. We'd love to have our pulse on all the different projects happening here in public health, as well as find out how we might be able to better support you in your efforts. Next slide. Finally, climate change can be a daunting issue. And for many of us, it really can weigh on us. It's no wonder to see how climate change is affecting our mental health. Many of us may experience climate grief or anxiety about the future of our planet. Taking action on climate change is not only crucial, but it also can help make us feel better and help us focus on the solutions. These are excerpts from one of the communication materials, a comic called Climate Changes Health that was developed by our communication staff. The right panel reads, "The good news is that our actions as individuals, neighborhoods, and communities can slow climate change. Climate change is health, so we must influence climate change. Our health and future generations depend on it. We as public health staff can influence climate change and help create a resilient community. I hope today's talk has been informational and inspired you to see all the great work that's happening in our own backyard and helped you find ways that you might be able to engage in climate change in your work. Thank you all for making time to join us today and learn about climate change. Please take a few moments before you go to your next obligation to fill out this quick survey that we'll drop in the chat, as well as please feel free to follow up with us or reach out if you have any questions for our team, or if you would like to request us to come to your team and provide a direct one-on-one engagement and help explore some ways that you might be able to bring climate change more into your work. Thanks for joining us. We'll dive into a brief Q&A session, and thank you.
Thank you so much, Addison and Brad. That was super informative. Hi, everyone. I'm Jen Dev, Communications Specialist for the climate team here. And I just want to open up the floor, or rather the chat, if folks have questions they'd like to ask. Do you have questions on the first half of the presentation around climate change and health equity? Do you have questions around what some of the work that the team is doing, or public health, or King County more broadly is doing? We'd love to hear any questions you have. So we left 10 minutes here. Please feel free to drop questions in the chat. Otherwise, we do encourage you to fill out that brief survey, redcap.links/CHE_feedback. If you know, it just takes a couple minutes and it'll really help us structure our next presentations for both public health as well as external partners. So we really appreciate you taking the time both to join us and give us your feedback. I'll leave the meeting open for a few minutes and see if anybody has any questions. But otherwise, thank you so much for stopping by. Thanks so much, Catherine. Catherine has written, she's sending a monthly newsletter to about 1,900 community partners. Wow, that's a great distribution opportunity. Catherine works with Communities of Opportunity as the communications person there. Do we have some message points we could include? What do you think partners would most like to hear? I think we could definitely connect about that, Catherine. Let's see, off the top of my head, we definitely have some resources that we could send for partners to check out. But Brad or Addison, do you have any other thoughts?
I'm just looking at the nice weather outside Chinook right now and thinking we're, coming up upon heat and wildfire season. So Jen, you're working on a communications campaign, so certainly something for the summer months. But then also, as we come up with opportunities to engage, we'd appreciate connecting with you on that. So thank you, Catherine.
And one thing I might add, if you are reaching out with community partners, one thing that can be helpful is asking them what messaging they would like to see. Because that's one of the things we don't always know what our community wants. So anytime we're engaging and find those opportunities to hear more, that can help us develop new messaging to help support these outreach in the future.
That's a really great point, Addison. And thanks, Brad. Yeah, we do have, so as was mentioned in the presentation, we do a yearly communication campaign around extreme heat. That'll be happening around mid-June to mid-July. That was co-created with some community partners. And this year, we've also obtained some funding to do a wildfire smoke campaign that will be happening in July and August. So we will also be working with our wonderful community navigators to co-create some of that content, as well as a flooding campaign later on this year. So we will have some great content coming up. Christian has said this was a great presentation. Thanks, Christian. How do you all go about gathering community input and guiding this work? Is there a forum that we could share it with others? Addison, you've done a lot of work with community.
Yeah, definitely. So there's several different ways that we try to engage with community, and we're always trying to find new ways to explore. One of the primary ways that we currently work through is through partnership with the Executive's Climate Office. There they host the, what used to be called the Sustainable and Resilient Frontline Communities Task Force. It has been renamed, and I'm actually spacing on the name of that right now at the moment. But Vicky Raya leads that team, and I'm happy to drop her email in the chat if you're interested in connecting with that group. I know they will be doing a significant relaunch as they work to update the upcoming strategic climate action plan. But also here at Public Health, we often we're trying to explore additional and growing partnerships and pathways of opportunities working with our Office of Equity and Community Partnership, as well as the community navigators. Now, we also have a number of different periodic opportunities that do come available. So we do have a community coordinations specialist or community partnership specialist, Con Ho, who is currently out on parental leave, but do feel free to reach out to either myself, Brad, or Jen and provide any information for community members or community organizations that might be interested in working with us, and we'd be definitely happy to reach out to them.
Thanks so much, Addison. And I'm sorry, I had missed an earlier question from Katie Ellis when she asked, when you talk about coming to talk with other public health staff, would it be to talk about our personal work or our programs? So we actually have a couple options. Brad, could you talk a little bit more about that?
Sure. Yeah, we imagine doing this Climate 101 sort of webinar with all of public health, and so this is the start of it. And so this is more of the awareness raising and in covering the basics, I guess. But what we've heard from folks is they actually want to dive in and workshop it. And so we see these next steps as workshops, and it could include a brief overview of this, maybe not the whole 30 minutes, or maybe you all watched the 30-minute video in advance of us coming, but then really hosting a virtual or in-person workshop where we can break into groups and really get into the work that you're doing in your unit or your section or your division, and start to put to life how that relates to climate and what that climate work could look like. And maybe you're already doing climate work, so really spotlighting that and either thinking of next steps. Some of the things we can add to the conversation are some subject matter expertise, and then also technical assistance of how to take those next steps. And then resourcing. There's a lot of climate money flowing right now, and a lot of times that's going through channels or avenues that public health hasn't traditionally applied for. Like, we recently applied to our first FEMA grant, and that is not necessarily a typical route that we take when we're looking for funding through public health. And so we can help you access climate-specific funding and other methods that the other agencies across King County are doing that could really benefit from public health's participation. So we're thinking like a 30, well, we can tailor it to your needs. If you already have a pre-existing meeting for your section or your unit, we can come to that, and we can 30 minutes, 45 minutes, 60 minutes, we can work with you. So we would just find a point person to co-create what that presentation would look like for y'all.
Thanks, Brad. And yeah, I think the word tailor is appropriate here. We're really aiming to work one-on-one with teams and hear what you all are most interested in learning about and what you want to work on and the type of climate work you're interested in doing. So if any of you do reach out to inquire about setting up one of these workshops, we have a short kind of list of questions that we ask you to answer that just help us understand better what your needs are, what you're interested in learning, and then we can work with you one-on-one to set something up. But this is one of our priorities as a team, is to really work with other staff at Public Health and, you know, getting the climate action work going and connecting with other teams that are already doing climate work to be able to, you know, collaborate, offer technical assistance, and so forth. So please do reach out to us. Again, our email is climateandhealth@kingcounty.gov. You're very welcome, Katie. And thank you so much, everybody. Are there any other questions? We have a few more minutes here. Yes, I see somebody has raised their hand, and give me 1 second because this is a webinar. So if you want to speak, I need to unmute your microphone. So 1 second. Okay, your mic is now enabled. Go ahead, Fanaya. I'm sorry, I don't know how to pronounce your name. Fanay, nice to meet you.
Oh, great. Yeah, nice to meet you too. Thank you so much. It's congratulations. It's very exciting to see this initiative moving forward. Oh, can you hear me? Okay. Yeah, I was saying congratulations. Yeah, we would like to coordinate with you, especially because we have EPA grant, the EJG2G. Currently, we're in the process of finalizing our scope of work with community partners. And we're also closely working with Vicky Raya and the Puget Sound Clean Air Agency in establishing a community climate resilience action group. So we would like to invite you to that meeting and present this exciting opportunity. We would like to hear more, especially we need your technical expertise in creating climate resilience toolkit for our community partners. Thank you.
Absolutely, Panay. We'll be happy to support. Sorry about that blasting of sound. We're all gathered here together in Chinook, but yes, more than happy to support. Please just forward us that invite or any details that you have to share with us. And yeah, we definitely look forward to hearing more from you.
Thank you so much, Vinay. Any other questions? We're just about at time. So thank you again so much for coming by, everybody. Have a happy Earth Day. And we'll be sending out an email after this with links to the resources, to our website, other information for you to check out. I did want to plug another climate talk that is happening later this week on Thursday. This is a climate action talk by the Executive Climate Office. And it is Thursday at noon, and they're doing a brief overview about the planned update to the 2025 Strategic Climate Action Plan. And there's a chance for folks to share their ideas. So I'm just going to pop that in the chat, and I'll also email you that information. But thank you so much for stopping by. It was so great to share the work of our team and of public health with you all. Oh, and one last plug for the survey if you haven't had a chance to complete it. The link is right there. We'd really appreciate your feedback on this. Thanks so much, folks.